Namaskar dosto and warm welcome to this special edition of Dr. KK's Med Talks. I am Dr. Sanjay Kalra, your friendly endocrinologist, and you are watching Dr. KK's Med Talks. आज का हमारा स्पेशल शो है जो कि 5वां शो है हमारी सीरीज में which we had planned before Ramzan. This is the 5th of our series which we had planned before Ramzan. Let's see what this special topic is today. हमारा आज का टॉपिक है today's topic is glucovigilance during Ramadan. Today we'll be having a talk show where first we'll have slides in English. पहले हमारी स्लाइड्स होंगी इंग्लिश में, हमारे खास गेस्ट, हमारे खास मेहमान जो हैं वो प्रेजेंट करेंगे ने, और उसके बाद हमारे क्वेश्चन आंसर्स होंगे इंग्लिश और हिंदी दोनों में. We'll first have a slide presentation in English followed by questions and answers in Hindi, English and any other language that you feel free to converse in. जो हमारे खास मेहमान हैं, our guest, he is fluent in not only English and Hindi but also in Telugu and Urdu. And थोड़ी सी पंजाबी और हरियाणवी मैं बीच में घुसा दूं. If I introduce a little bit of Punjabi and Haryanvi into the conversation, so that's lots and lots of languages. And it is important also to have all these languages because it's important to have these languages because Ramadan is universal. हर language, हर भाषा, हर जुबान के लोग रमजान रखते हैं. So people of all languages, all ethnic groups follow the Ramzan fast, and therefore it is important to have a universal discussion on this. But before we talk of this topic, let's have the news for today. Let's look at our news. Worrying signs for India amid the fourth wave scare, lockdown and mass COVID-19 testing in China. चाइना में शंघाई शहर जो कि 25 मिलियन 2.5 करोड़ आबादी का शहर है वो लॉकडाउन में चला जा रहा है. So because of this we are afraid that actually COVID-19 fourth wave might come to our borders as well. But still things are looking upbeat right now, and after 2 years India has resumed routine international flights. तो कल से, that is yesterday वाला कल से international flights हमारी फिर से शुरू हो गई हैं. The government is considering COVID vaccine booster for Indians traveling abroad for education and business commitments. So if you're an Indian, you want to travel abroad, it would be a good idea to get a COVID vaccine booster before you travel. And for the past 2 years, we've been listening to this wonderful tune, जो कॉलर ट्यून थी हमारी COVID-19 वाली, जो हमें याद कराती थी सतर्क रहें. This caller tune which reminded us to remain vigilant. This is going to stop soon after 2 years of reminding us to be vigilant. And of course, China, the neighboring country that we have, it is continuing to battle not only COVID, but also complex and severe COVID. So things are quite bad there. So with this news, let's come to our topic for today. We've introduced our topic. Let me introduce our guest, a very close friend, Professor Rakesh Sahai from Hyderabad. Warm welcome, Dr. Sahai.
Good evening, Dr. Sanjay. Good evening to all who have joined here in this evening's program.
Good evening. So we'd not introduce you, we'd just actually introduce your linguistic skills. So हम क्या कह रहे थे कि डॉक्टर राकेश इंग्लिश, हिंदी, उर्दू, तेलुगु में बात कर पाएंगे आपसे, तो जिस भी जुबान में आप सवाल पूछना चाहें, feel free. But Professor Sahai is Professor and Head of Department Endocrinology at Osmania Medical College in Hyderabad, India. He is the President of the Endocrine Society of India. तो जो हमारी एंडोक्रिनोलॉजी सोसाइटी है इंडिया की, वो डॉक्टर साहब चलाते हैं. He is also on the executive board of the RSSDI, which is the Research Society for Study of Diabetes in India. And अगर सिंगल सेंटेंस में हम डॉक्टर साहब का सीवी देना चाहें या इनका बायोग्राफी देना चाहें, वो ये कहेंगे कि प्रोफेसर साहे का सिक्का चलता है, अकेले इंडिया में नहीं, पूरी दुनिया में. Now it is difficult to find an English translation for that sentence, Dr. Sahai. But can you try? Dr. Sahai ka sikka chalta hai. What is the English translation for this?
Well, I think you're exaggerating a little bit, so I find it difficult to say what would be the word for that. Yeah.
So now let's think. Now sikka chalta hai means the coin works, but I think a close transliteration in English would be that Dr. Sahai's word carries weight.
Correct.
डॉक्टर साहब के जो लफ्ज हैं, जो डॉक्टर साहब के अल्फाज हैं, उनमें वजूद है. His words carry weight. And that's what we'll try to learn from him and share with him today. So, Dr. Sahai, the holy month of Ramzan is approaching, just a few days left. And these are the last 3-4 days of Shaban. Now, many people worry about how they will be able to fast during Ramadan. In the KK Med Talks shows, we have already had 4 programs on pre-Ramadan education. Different experts from different parts of the country, and all have tried to help. सबने हमें एनरिच किया है, सबने हमारी मदद की है. अलग अलग पर्सपेक्टिव, अलग अलग लाइजे से हमें रमजान का महत्व समझाया है. They have taught us the importance of Ramadan, and they have also taught us how to manage diabetes and general health during Ramadan. आज हम बात करेंगे ग्लूकोविजिलेंस की. So, Dr. Sahai, we understand that first you will present slides in English, and after that we can have question answer in multiple languages. But before you begin your slides, can you define what Ramadan is and what glucovigilance is?
Yeah, so Ramadan, as Sanjay has very clearly said, Dr. Sanjay Kalra has said that it's the holy month in the calendar year. I mean, and this is the month when all the Muslims in across the world are fasting, and they all want to fast. And what we see that many of our patients with diabetes who also want to fast, we try to see how we can help them in safely fasting, because fasting में ये होता है कि जो you're without any food intake for almost 12 hours a day, 12 hours, and in some parts of the world it is even longer. So during this period, if we are able to see that they do not go into problems like hypoglycemia, then we can see that they can fast comfortably, and they can achieve their objective of fasting comfortably without any problem. So that is our main objective when we are trying to see how we can see that our patients are able to fast safely without any medical problems.
So that is glucovigilance also, that you are vigilant
And
about
then,
diabetes.
yeah, and then we are vigilant about diabetes, because glucose levels are changed, I mean, are highly dependent on the food intake. And if somebody is without food intake for a long period of time, there are changes in the metabolism in the body. And although their body has mechanisms of keeping the glucose levels in the normal range, but somebody who has got diabetes or who is on medications, then those medications can sometimes cause the blood glucose levels to go down. So we have to make appropriate adjustments in the medications which a patient with diabetes is taking, so that he does not go into hypoglycemia during this period of fasting, which is a long period of time during the daytime. He's So if we are able to do that, then that is what we are trying to achieve.
So जो ग्लूकोविजिलेंस है, इसका मतलब है कि हम ग्लूकोज के बारे में, शुगर के बारे में सतर्क रहें, चौकन्ने रहें. लेट अस रिमेन विजिलेंट. आजकल न्यूअर टेक्नोलॉजीज हैं, न्यूअर डिवाइसेस हैं which help us remain glucovigilant, and we can help people fast safely in a fulfilling manner. हमने बात
And
की थी
today,
कि डॉक्टर साहब का सिक्का चलता है, इनके अल्फाज चलते हैं. तो एक IDF डार गाइडलाइंस हैं, इंटरनेशनल डायबिटीज फेडरेशन, डायबिटीज अलायंस फॉर रमदान गाइडलाइंस हैं, जिसमें देयर आर ऑथर्स फ्रॉम अक्रॉस द वर्ल्ड, and from India we have 2 authors, Professor Sahai and Dr. Shaila Sheikh. So we would like to thank Dr. Sahai and Dr. Shaila Sheikh, as well as all the other authors led by Dr. Hasnan from Egypt, who have contributed to this task. Dr. Rakesh, greetings to you from Savita Bhutani ji, Seema Bindru ji from Kolkata, Anamika Nu, Anshu Singh, and Dr. Noor Aga Danish आपको सलाम कर रहे हैं from Kabul in Afghanistan.
thank you.
And if you could begin with your presentation, and we
Yeah.
welcome everybody to post their questions so that we can ask them once Dr. Sahab has finished his presentation. While we begin, एक interesting anecdote बताता हूँ about Osmania Medical College, जहाँ से डॉक्टर साहब हैं. Osmania Medical College is a 140-year-old medical college in Hyderabad, India. And 100-125 साल पहले, अब एनेस्थीसिया इज द सब्जेक्ट जिसमें बेहोश करते हैं लोगों को, बेहोशी का सब्जेक्ट है ये। बेहोश किया जाता है ताकि ऑपरेशन ठीक ठाक हो सके। अब सबको ये नॉर्मल लगता है, रूटीन लगता है, बट 100 years ago it was not like that. And it is Osmania Medical College, Hyderabad, India, which actually spearheaded the science of anesthesiology. जब इंग्लैंड में, लंदन में लोगों को पता चला कि हैदराबाद में इस तरह से एनेस्थीसिया दिया जाता है इन केमिकल्स के साथ, तो वो बहुत हैरान परेशान हुए। तो उस्मानिया मेडिकल कॉलेज की टीम गई डॉक्टर्स और मेडिकल स्टूडेंट्स की लंदन में उन्हें एनेस्थीसिया पढ़ाने के लिए। सो दिस इज द लेगेसी, द हेरिटेज दैट डॉक्टर सहाय इज कंटिन्यूइंग नाउ। दिस इज द लेगेसी ऑफ हिज मेडिकल कॉलेज, दिस इज द लेगेसी ऑफ इंडियन मेडिकल साइंस।
Dr. Sanjay, is my screen visible?
No, not yet.
Not yet.
Perhaps if you want, Pratik can sort of project them for you.
Okay.
Pratik, if you can project the slides. Okay.
Okay. So once again, welcome to all those who have joined here from across the globe. I hear that there are people who have joined from across different countries across the globe. So I welcome all of them. And today, what I would like to discuss in the next few minutes is about glucovigilance in Ramadan, in the holy month of Ramadan. Next slide, please. So, as we were discussing, we are just a few days away, and the we are just a very few days away from Ramadan, and we are going to enter into this month of Ramadan, and during this month we want to see that all our patients are vigilant about their glucose levels and are able to fast comfortably without any problem during this month. Next slide. So, as I was mentioning, that across different parts of the world, there are more than 1.6 billion Muslims who are going to fast across during this period, and many of them have diabetes. More than 30% of them have diabetes, and therefore it is very important that we educate all of them. We have discussed this in the previous med talks about KK med talks about pre-Ramadan assessment, how we need to assess the risk of involved in different patients, whether they are at risk of fasting or whether they can comfortably fast. And the other important point that I was mentioning is that in different parts of the world, the duration of fast is very variable, and it can vary from 10 hours to almost going up to 18 to 20 hours also. Next slide, please. So this slide shows that how this varies from some parts of the world where the fasting may be only for about 11 hours, while in other parts of the world like Stockholm and London it is almost going up to about 20 hours. So it is in these parts that they have greater risk of having low sugar levels, and they need to be more vigilant, and they need to test their glucose levels, and they need to see that they don't go into hypoglycemia. Next slide, please. Now, so basically, what we are saying is that we want to, when we are seeing a person with diabetes who wants to fast and during the month of Ramadan, what we try to do is that we want to first is do a proper risk stratification so that we can make him aware of what are the risks that he has, and how much of what changes in the medication he has to do, how he has to change his diet, how he has to change his lifestyle, and whatever, the timing of medications often needs to be changed, the dose and timing of medication needs to be done. So we would discuss about these aspects, and also tell educate them that it is very important that they are able to test during they test their glucose levels during the fasting period, and also they understand when they should break their fast, because while we know that it is important to fast, we should also know that when there is a situation where there is some problem, and when there is a very low sugar or when there is very high sugar, then the person should be aware of that. He has to break the fast on that particular day, and he can take corrective actions and go on later on with the fasting. Next one. So we are very particular. I mean, when we are seeing patients in the month before Ramadan, we would like to see that we look at their what are the various situations. I mean, how what is the type of diabetes that they have, how they're what type of medications they're requiring, and based on this we do a assessment. Next one, please. As you can see here, Dr. Sanjay was just speaking about the IDF and DAR guideline, which came out last year, which we worked on last year, and this was published very recently. And in that guideline, what we try to do is try to understand how much a person has a risk of having problems with fasting, and how much changes what sort of changes are required for a person to be able to fast comfortably. To understand that, we have made a risk stratification, and this risk stratification is based on the type of diabetes, the level of control that the person is maintaining, and also the type of treatment that is taking. Somebody who is taking treatment with just a few medications, or just on diet and exercise, probably doesn't have as much risk as somebody who is on many medications, or who is on taking insulin, multiple doses of insulin per day. Even those who are taking insulin, it is not that all of them have the same risk of having problems. Those who are taking a single dose of a basal insulin or once in the night may not be at that much risk as a person who is requiring multiple doses of insulin throughout the day. So based on this, we have made a risk stratification scoring, which is very easy now to understand for every doctor across the world. It is very easy to understand whether his or her patient is at how much risk the person has, and then accordingly, the person can be given advice on whether he should fast, whether he should not fast. There could be some people who should not be fasting because they have significant problems, and by fasting they are going to put themselves at risk of developing problems and further increasing the complications of diabetes, which they may already be having. Next slide, please. So based on this, we arrive at a score. As you can see, I will not go into details of this, but what I will say is that the people who are in this green zone are the ones who have a score which is less, and they can comfortably fast. They do not require much of change in their medication. Those in the orange zone require some changes in their medication and can still fast. They should be given they have to be educated on what they should do when they have a problem. And finally, the red zone, those who are in the red zone are the ones who should whom we will tell from I mean whom we will advise them that they should not be fasting, because they are going to put themselves to greater risk if they are going to fast. So this is a common, a very practical scoring system that was developed. Now, coming quickly to some aspects like how to what sort of changes are required in the diet, because that is the most important thing, apart from changes in the medicines which we will discuss about. But changes in the diet are very important, because while fasting is important, while a large time of the day is spent in fasting, maybe about 10 to 12 hours or even more than that is spent in fasting. But after the fast is broken, we should be able to tell our patients, explain to our patients that they should not be uh, in I mean eating more than required, because then what happens is that they have, while they had low they may have a risk of low sugars during the fasting period. They may end up with very high sugars during the evening period. So that is again one advice that has to be given, that the evening meal also should be appropriate, and we should not be and we should also see that the meal in the morning, the suhoor meal in the morning, is also taken, so that they are not at risk of developing a problem during the day. Next slide, please. So, how to distribute the calories? It is very important to understand that in a normal day, people would be distributing the calories between the lunch, breakfast, lunch, dinner, and many snacks in between. But during the fasting month, we need to distribute it mainly between the two major meals. That is the iftar meal in the evening and the suhoor meal in the morning. So the calories have to be distributed particularly between these two meals, and we would try to see that the distribution of the type of food that is taken is also appropriate, which is shown in the next slide. Next, please. We use this plate model to make patients to so that patients understand how the plate has to be. So as you can see here, this is a, if you can see that the plate shows us that half the plate should be with vegetables and fruits, and then you have one fourth of the plate having cereals like rice or chapatis, and then you have one fourth of the plate having protein intake. Then when the fast is broken, you have a few dates, not too many, maybe 3 or 4 dates, and maybe some fruit here, and also a glass of milk in the evening. So this typical plate gives about 700 calories to the person. So that will take care of maybe 50% of his meal related requirements. Then he can even have a evening snack, and then early morning suhoor meal, which is again similar to this plate. So this plate gives us a good understanding of how the distribution of food should be done in the plate, so that gives a good amount of takes care of the calorie requirement, and at the same time does not cause a wide fluctuation in the blood glucose levels. So when you're looking at glucovigilance, our glucovigilance should start right from looking at the diet that is taken, in the food that is eaten, because that is the major one, apart from the medications which we are going to speak about. Next slide. This is again showing the same thing. So next, we'll go to the next one. Next one, please. Yeah. So what we are saying is that we need to see that we have a proper balance in the food that is taken, divide an adequate amount of calories between the evening iftar meal and the suhoor meal, and then and also see that you avoid sugary desserts. We advise our patients to avoid too much of desserts in the evening, and try to consume more of high fiber food, more of cereals, grains, and also we would say that take the suhoor meal as late as possible. Take enough water during the evening time, so that and now we are actually in the summer months, and Ramadan has come in the summer months to now, and the heat is also increasing across the country. So what we would say is that we need to see that adequate amount of water is taken during the evening hours, and also what we should say is that we should have some amount of, when we break the fast, we would advise our patient that when they break the fast, do it with a 1 or 2 dates, have a fruit, or have some food which is not very rich in calories, and then go on to the higher density foods, so that there is a proper distribution of the calories, and also the rise in blood glucose does not happen to that extent. Next one, please. Now, having looked at that, Abhi, then we are moving on to understanding how we should make changes in the medications of patients, so as to see that there is a proper, balance between the medications, and to see that they do not develop low sugars during the fasting hours. So some of the medications like metformin and acarbose. For those who are uh, familiar with the medications, it may be easy, but for others, I would like to say that there are some medications like metformin and acarbose, and these medications don't require much of a change, because they don't cause the sugar to go below normal. So they can even be taken in the morning, they can be taken in the evening, with the evening meal, and also with the morning meal. But there are other medicines which increase the insulin level in the body. They can have a tendency to decrease the glucose levels during the fasting hours, and those medications need to be sort of avoided during the morning, or even if they're required to be taken, they need to be taken in smaller doses. So we need to make adjustments in the dosing of these medications between the morning and the evening, and we need to make some see that appropriate dosing is done so that they don't develop hypoglycemia during the day. Now, there are some other medications, like newer medications, like many of the patients may be on medications like SGLT2 inhibitors, which are very good medications in terms of providing protection from complications of diabetes, providing good control of diabetes, and also helping in reducing the weight. But these medications can increase the urine output to some extent, and therefore can cause a little bit of dehydration in people who are fasting. So we would preferably use this. Normally we use these medicines during the daytime, but in during the fasting months we would prefer to fasting month we would prefer to use this medicine in the evening. So such changes in the medicines are required to be done by the prior to the month of Ramadan, so that uh, the fasting period can go comfortably without any hypoglycemia. Next one. So this is just showing how we need to make adjustments in the dosing of medicines. Metformin, as we said, doesn't require much of adjustment because it doesn't cause hypoglycemia. Next one. And many times we may require some changes in medicines. Next one, please. Yeah. uh, Next one. So some medicines, like I was saying, that many patients across the world are on these medicines like glibenclamide or glimepiride or glyclazide. So these medicines require some change in their dosing. They have to be, the dose in the morning has to be frequently avoided, or maybe just a half a dose may be required in some patients who still require it during the daytime. But generally we would prefer to give them in the evening time. Next one. And then what we are saying is that these new drugs called the Sglt2 inhibitors, we have two or three different medications in this category. We have dapagliflozin, we have empagliflozin, we have canagliflozin. So these are very good drugs which are being used across the world, and in many countries across the world. And when people who are using these medicines, we would try to see that we make a shift in the timings. That is, we would ask the people to take it in the evening rather than taking it in the morning, as we would otherwise do with these medicines. Next one. Next one, please. Yeah. Uh, then there are other medications like the GLP1 analogs. These are called. These are all injectable medicines. We also have a oral medicine now available. So these medicines, what we would do is that they do not cause hypoglycemia again. So they have been tried in different studies across the world, and what we have seen is that these medicines can be used safely without any problem. They don't cause hypoglycemia. They may in fact be good in terms of seeing that patients do, I mean, people with diabetes don't gain weight also during the during the use of these medicines. Next slide. So again, what we are saying is that when you're looking at insulin, what we say is that there are three different ways in which people may be using insulin. They may be some of the people may be using a long-acting insulin, which is taken only once a day. The typical examples are glargine and degludec are two types of insulins which are used just once in a day. So people who are using that once in a day can continue using almost the same dose or little lower dose, can be given in the evenings when not during the fasting period but in the evening period. While those who are taking other insulins which have to be taken multiple times of the day, then adjustments have to be done. They would not be advised to take insulin during the daytime, but some of them may require a smaller dose of insulin in the morning along with the suhoor meal, and while the major part of the insulin will be given in the evening. Next. Next one. So this was about the insulin. Some people may be on insulin pump, particularly type 1 diabetics. These are people who are not having insulin at all in their body, and they depend on the insulin that is given from outside. So they cannot be off insulin for a long period of time. So in such people, we uh, uh, we would generally advise them against fasting, because they are at greater risk when they are fasting. But those who still insist on fasting, those who are on insulin pump, it is easier for them, because we could adjust the dose of insulin during the fasting period to much lower levels, but a small dose of insulin throughout the day, while during the evening hours when they require more insulin, we can adjust the insulin delivery through the pump in such a way that they do not have problem during the daytime, during the fasting period. Next one. Now comes the most important part, that is the glucovigilance, the most important part of the glucovigilance that we're saying. While while in the earlier part, the doctor was doing most of the thinking in terms of understanding how to make changes in the dose and advise the patient. But here comes the person himself. He has to understand that he has to monitor his blood glucose levels. He has to do self monitoring of blood glucose, which is a very important part in diabetes management. Even otherwise, I mean, at any point of any time of any in any circumstance, is a very important part. And during the month of Ramadan, this plays a very important role. Earlier, people, there was a misconception. Many people used to think that doing a blood glucose estimation or doing a monitoring of blood glucose would mean breaking would lead to breaking of the fast, but it is not so. It has been clarified by many religious leaders across the world. They have clarified that checking the blood glucose level does not, by a glucometer, does not lead to a breaking of the fast, but is not equivalent to that. And they would advise people to check their blood glucose, because this is an important component of management of diabetes, so that they can fast safely, they can have a safe fasting without going into problems. So now what we see is that people with diabetes who are fasting should essentially check their blood glucose. And ideally, we would say that you check at least 7 times in a day, 7 times during the day. But at least 2 or 3 times, 2 times or 3 times is very important. And particularly when you're seeing the next slide, please. Particularly if you look at the entire day here, this is a very good representation, which saying that, during the you may the we need to check once 1 hour, at least 1 or 2 hours after the morning suhoor meal, then check in the afternoon, and then certainly do check in the evening before the iftar. So towards the later part of the evening, when the there is a highest risk of having low sugars, it is at that time that we should check. And then also after opening the, I mean, after the fast is completed, in the evening after the iftar meal, also 2 hours after the iftar meal, it may be a good time to check, to understand whether there is a high, I mean, whether there's a rise in glucose happening because of the iftar meal or not. So that is another time that we would like to check. And once in the night. So these are the different time points when it would be advisable for people to check their glucose levels and understand how their bodies is handling the fast, and how they should whether they should make any changes in the medication. That will also help us in understanding whether there's a need for change in the diet. All these aspects can be understood by the self monitoring of blood glucose done during the fasting period. Next one, please. So as we have seen that, unless we have a good understanding patient, and unless our patients understand very well the importance of monitoring of blood glucose, they would not be able to do it effectively. And it is always a challenge that we should be able to overcome the negative attitudes many people may have about testing frequently. So if you are able to explain to our patients that it is very important for them to test regularly, test even during the fasting period. It is important in terms of understanding the how the changes are required in terms of the meal pattern, in terms of the medications. All these things can be understood by regularly testing. And today we have very good devices available for testing. You can see on your screen, you see Roche Diabetes. That is a company which is which is known for the easy devices. I mean, the devices which are very easy, very convenient to use, and which give very accurate results. We have several devices available across the world, and we suggest that all our patients should monitor their glucose levels during the fasting period, and see that they are able to fast safely without any problems. Next one. And today we have a integrated personalized diabetes management program available from Roche, which is a system where in the glucometer that we're using for testing is connected through Bluetooth and through various other mechanisms. It's connected with to an app in the phone, and also connected with the doctor's computer also. And so we have a connected environment where whatever the patient is checking and whatever the readings that are seen are conveyed to the doctor also, and to the healthcare provider, or it may be a doctor, it may be to a nurse who is looking after the diabetes, or it may be any other person who's looking after the adjustments in the medications. And through this, we could safely make adjustments in the medications, and we can see that we provide this benefit. The patient has the benefit of a proper supervision and a proper care, which is done by this system, which is called the integrated personalized diabetes management system, which is a very holistic approach in terms of glucose monitoring provided by this system. Next slide, please. So what we see is that this is showing us how this system works, how we could provide a structured education through this system itself, how the patient can get information about their diabetes, how it could help them being connected with their healthcare providers, and how it can lead to a better management of their diabetes with better adjustment in their medication doses according to the feedback that is given by the glucose readings that we are seeing on the glucometer. Next one, please. So this integrated personalized diabetes management has certainly made a big difference in all the studies that have been done till now. It has shown that we could improve the time in range, or the time for which a patients are in good control of their diabetes, and they are protected from developing various complications of diabetes. Next one. These are the glucometers that are connected. They are connected, as you can see here. The picture shows how the glucometer is showing the reading, and then that reading is transmitted to the cell phone, and it is connected by to the not only to the to patients relate I mean patients caregivers in his home, or also to the doctor, to the healthcare providers who are taking care of the patient. And through this, we are seeing that we are finding a beneficial effect in terms of providing a comprehensive uh, digital solution to a motivated patient. So a person who is motivated and who has this tools available with him can effectively manage his diabetes. Next one. And this is particularly very important during the holy month of Ramadan, because it enables patients to be able to it makes them competent to measure their blood glucose levels, to take decisions regarding their medications, to be able to take decisions regarding their dietary changes that are required. And all these can actually make the fasting experience more comfortable, more safer for every patient with diabetes. Next. Yeah. Next. So this is a very important slide which I wanted to highlight. So we have seen the how the measurement of blood glucose is very important, because that gives us useful information, and through a connected system like Ipdm, we will be able to provide a more comprehensive and better care to our patients with diabetes. Now, next is when should a person break the fast? He should break the fast if blood glucose level goes below 70. That is called hypoglycemia. At the same time, he has to break the fast if it goes very high, more than 300. Again, it's a very dangerous situation. So in both these situations, a person should break the fast. Hypoglycemia can be sort of known to I mean to a person if he has trembling, if he has sweating, if he has got palpitations, feels very hungry, or he has he's feeling very confused and having a headache. At the same time, sometimes hyperglycemia also can have similar, very high sugars also can have similar sort of manifestation. So it is very important that a person is able to check the blood glucose, then only he can understand whether it is going low or high. And because many of the symptoms may overlap between the two, but typically we are worried about a blood glucose level going low, because that causes damage to the person in within minutes. Whereas if it's going high, it may be a gradual sort of problem that maybe that can be overcome by different sort of ways in which it has to be overcome. But the important point is that we should check the blood glucose. If it is less than 70, then it is advisable to break the fast. If it's more than 300, it's advisable to break the fast. So these are the situations. Or if there are symptoms, when the person has troublesome symptoms like this of hyperglycemia or hypoglycemia, the person should break the fast. So these are the points that I would like to highlight to everybody who is attending the program today. And with that, I'll conclude. And uh, next slide, please. I will thank you all for your patient hearing, and I'll ask Dr. Sanjay to take over.
Thank you, Dr. Rakesh. Thank you very much for that talk. And lots of questions that we have. बहुत सारे सवाल आए हुए हैं. ये सब related हैं to diabetes and also to glucovigilance. So, Dr. Rakesh, you've talked about the concept of glucovigilance, and in the end, you spoke about glucose monitoring and different ways of personalizing glucose monitoring. Maybe in 1 or 2 minutes, हिंदी में अनुवाद करना चाहेंगे इसका? IPDM, glucose monitoring, structured glucose monitoring.
Yes. So रमज़ान के महीने में जब फास्टिंग कर रहे हैं, जब जब रोज़ा रख रहे हैं, तो उस टाइम पे ग्लूकोज चेक करना बहुत ज़रूरी है. कई बार कई लोग ये भूल जाते हैं कि ग्लूकोज को चेक करना इम्पोर्टेंट है, और उसकी इम्पोर्टेंट अहमियत काफ़ी है, क्योंकि उससे आपको पता चलता है कि आपके डाइट में क्या चेंजेस करना है, आपको आपके मेडिकेशन में क्या चेंजेस करना है, और उसी के मतलब इस मॉनिटर करने से ही आप ये कर सकते हैं कि आपका फास्टिंग सेफ हो सकता है और विदाउट एनी प्रॉब्लम्स. नहीं तो अगर आप ये नहीं करते हैं, तो कई बार सडनली ब्लड शुगर कम होने पर या बहुत ज़्यादा हो जाने पर आपको फास्ट ब्रेक करना पड़ता है. तो उससे ये बेहतर होता है कि आप अगर मॉनिटर करते रहें, तो आपको ये पता रहेगा कि आपको क्या चेंजेस करना है. आपके डॉक्टर से आप एडवाइस ले सकते हैं. और ये जो आईपीडीएम सिस्टम के बारे में बता रहे थे, तो उसमें यह है कि आपका जो ग्लूकोमीटर रहता है वो कनेक्टेड होता है, आपके सेल फोन से कनेक्टेड है. आपके डॉक्टर या आपके जो भी हेल्थ केयर प्रोवाइडर जो आपको बता रहे हैं, एडवाइस दे रहे हैं, उनसे भी कनेक्टेड हैं. तो वो भी आपको एडवाइस इमीडिएटली दे सकते हैं. मतलब वो देख सकते हैं आपका ग्लूकोज रीडिंग्स क्या आ रहे हैं, किस रेंज में रह रहे हैं, और उसके हिसाब से वो आपको एडवाइस दे सकते हैं, आपके दवाइयों के बारे में, आपके मेडिकेशंस के बारे में, आपके डाइट के बारे में, आपके सभी एस्पेक्ट्स पर एडवाइस दे सकते हैं.
मिस्टर राम बाबू, मिस्टर प्रतिपति राम बाबू पूछ रहे हैं, व्हाट इज द इम्पोर्टेंस ऑफ 24-hour ग्लूकोज कंट्रोल and 24-hour glucose monitoring? So if we can do one by one, first the importance of 24 glucose monitoring. हमें बार-बार शुगर क्यों चेक करनी है 24 घंटे में?
हाँ, तो इसलिए चेक करना है कि शुगर जब भी बढ़ता है, तो हर एक टिश्यू में कुछ थोड़े से चेंजेस होना शुरू होते हैं, जिसकी वजह से जो धीरे धीरे एक्यूमुलेट होकर उससे कॉम्प्लिकेशंस आते हैं डायबिटीज में. तो इसको आपको इसलिए ये देखा गया है कि जो 24 घंटे का मॉनिटरिंग होता है, उसमें आपको पता चलता है कि कितने घंटे आप नॉर्मल रेंज में रह रहे हैं, कितने घंटे आप शुगर आपका बढ़ के ज़्यादा रह रहा है, और कितने घंटे कम रह रहा है. तो तीनों सिचुएशंस में इसकी अहमियत है कि आपको पता करना है कि कितना टाइम आप नॉर्मल रेंज में गुजार रहे हैं. तो अगर आप 80% टाइम या 70% टाइम नॉर्मल रेंज में आपका नॉर्मल रेंज में बीत रहा है, तो आपको उसके कॉम्प्लिकेशंस रहने के आने के चांसेस कम होते हैं.
And Mr. Pratibhabu continues with this discussion. So, Mr. Rambabu, जो डॉक्टर साय ने कहा कि the more the time that you spend in range, the less the chances of complications. The more the time that you spend out of range, whether with high glucose or with low glucose, the more the chances of complications. So, if we want to prevent complications, we have to keep our patient in control during the month of Ramzan and even otherwise also. And how do we find out whether we are keeping the patient under control? We have to keep on checking glucose again and again. And this brings us to the next question that you have asked. So his question is, what is the level of glucose in the blood, and how much time should this level be exceeded to damage the endothelium of the blood vessel? So
Yeah.
जो
So
खून की नसें हैं, जो धमनियां हैं, उनकी अ, जो अंदर की परत है एंडोथेलियम, वो डैमेज हो जाती है हाई शुगर से. सो द क्वेश्चन इज वेरी वैलिड. हाउ लॉन्ग शुड दिस ग्लूकोज बी हाई एंड हाउ मच शुड इट बी हाई?
yeah. So as we were saying that when we are seeing in the normal range, what we define is anything between 70 to 180. तो उसको नॉर्मल रेंज बोलते हैं, मतलब एटलीस्ट फॉर ए पेशेंट विद डायबिटीज. फॉर a person who does not have diabetes, it may be actually lower. It may be just between less than 140 also. It may be between 70 to 140. But with the person with diabetes, we give a allowance to for up to about 70 to 180. So agar if he is able to spend 70% of the time in that range, then he is protected from complications. If he is spending less than that, if he is spending only 50%, then he has a higher risk of complications. So ideally it should be 100% of the time in that range, but since we cannot always be at the ideal, so what we are saying is that at least 70% if we are able to spend in that range, then we are protected from complications.
So ideally 100% of the time, but वो करना बहुत मुश्किल है. But minimum 70 to 70% or more, we should remain within range. अरुणा त्यागी जी, नीरज त्यागी जी भी आपको नमस्कार कर रहे हैं. शुभ संध्या, गुड इवनिंग. And Dr. N.S. Sharda sir from Ahmedabad sends you his blessings, Dr. Rakesh.
Thank you.
One more question we have, and that is about glucovigilance during the fasting period. So, you have now 2.5 decades of experience in endocrinology. ढाई दशक से ज़्यादा हो गए हैं आपको endocrinology में. तो what is the difference between then and now? Checking glucose between सुहुर and इफ्तार during the fasting period. जब हम शुगर चेक करते हैं सहरी के बाद इफ्तार से पहले, क्या इससे रोजा टूट जाता है? इससे खराब हो जाता है क्या रोजा? What is the difference in thought process now?
Yes, I think there has been a lot of difference in thought process. 10 till 10 15 years back, it was always thought that even a small drop of blood coming out is a problem. Is मतलब उससे रोजा टूट जाता है. तो it used to happen that nobody used to check, and we were always in confusion where what is happening during that period. We did not know what our patients were going through. But now, since it has been clarified very clearly that a small prick which is used to do a glucose test, as we are doing it with a glucometer now, it is much easier. You've got a very small lancet devices which do not cause any pain at all, and there's a very small drop of blood which is coming out, which is used for measuring the glucose levels. And with the new instruments which are available, which we get to know in 5 to 10 seconds, we know what is the blood glucose level. So uh, one is the technology has become much better in the last 2 decades, and I think our own understanding that checking is not going to break the fast. That is an important change that has happened.
So, रोजा तब आपका टूटेगा अगर आप कोई न्यूट्रिएंट, कोई खाने की चीज अंदर लेंगे शरीर में. इफ यू ईट समथिंग, ड्रिंक समथिंग, इवन स्वेलो समथिंग, तो रोजा टूटता है. बट यहाँ पे तो हम ग्लूकोज बाहर निकाल रहे हैं, ब्लड बाहर निकाल रहे हैं, तो रोजा टूटने का कोई चांस नहीं है. एंड देयर आर फतवाज फ्रॉम अक्रॉस द वर्ल्ड, फ्रॉम द उलेमा, फ्रॉम द रिलीजियस स्कॉलर्स फ्रॉम अक्रॉस द वर्ल्ड, where it is very clearly said that you can check your glucose during the fasting period. Actually, it is a duty to check your glucose because the creator wants, अल्लाह चाहते हैं कि आप अपने शरीर का ख्याल रखें, that you should take care of your health. One more question, Dr. Rakesh. Many times people come in saying that I go to the lab and I get my glucose checked once a month, once in 2 months. That glucose is always normal. So they stay like that for 2 or 3 years. After that, they begin developing complications. Is this common in your practice?
Yeah, we do see many people doing that because they are not checking in between. Now what we have realized is that because when you're doing it so infrequently, once a month when you're checking, you're missing out what is happening during the other times of the day, during the other times of the month, during so many days in between. You're checking only once in a month or once in 2 months. Many people are checking once in 3 months. So what is happening in between is what is deciding whether you're developing complications. And by the current methods that we have, I mean the instruments that we have, it's very easy to check glucose levels frequently. Whenever you have any confusion, any problem, you can check. Whenever you eat something new, you can check and see how is the response of your glucose levels to that. Whenever you have any feeling, any new feeling, you can do that. So this has actually made it very comfortable, and also people are now understanding better about their diabetes, about their food intake, what they should eat, what they should not eat, by checking frequently.
Here in Haryana, in Punjab also, we have something called the Canada wali auntie syndrome or the Canada auntie glucometer syndrome. So that
Hmm.
syndrome is कि glucometer खुद तो हमने खरीदना नहीं है because that is below dignity. But Canada वाली आंटी अगर गिफ्ट करेंगी तो then we are fine with that. But Canada वाली आंटी 10, 20, 30 strips लेके आएंगी. She can't bring you 365 strips. But still she brought 10. So until then we keep on checking the glucose. When the strips begin to run out, we stop checking. And दूसरा क्या है, we suddenly realize कि Canada में the units are different. So would
Hmm.
you like to speak about that and how this can lead to errors? Supposing my
Yes.
glucometer is showing a glucose of 10
Yeah.
and I've got it from Canada or from abroad. Does that mean it's high? Is it low? And how do we interpret this?
Correct. So the measurement system is different in different parts of the world. You have got SI system and different systems that are called. So the one which we use here is the milligrams per dl. Per dl means per 100 ml. So the milligrams of glucose in 100 ml of blood. So that is what we measure. And normal, as we said, is between is normally say 70 to 100 in the fasting state, 70 to 110 or 120, and in the after food it is anywhere between 140 to 180. So that is what we are saying in normal this thing terms. But when you look at the other units, that is millimoles, which is used in many parts of the world, like when you go to UK, you go to Britain, or you go to Canada, that is how it is measured. And that is 1 millimole is equivalent to 18 milligrams. So you if you get a reading of 10, as Dr. Sanjay has said, it means 180 milligram, not 10.
So वो भी अपना ख्याल रखना है.
Hmm.
And then the other point is why I got my Canada aunt to give me the glucometer is because I was guaranteed that the quality is good abroad, whether it is Canada or Dubai or anywhere else. But does that mean that all glucometers available in India are not of good quality?
I think that is no longer valid. I mean, maybe 4 or 5 decades back we could speak of things like that, but now we are making better glucometers. I think in all aspects, India has progressed so much that you have very good quality medicines, or good quality instruments available in India. And what we have is world class instruments available. The glucometers are excellent, very good. And the important point to note is that different parts of the world, they have different models available. So the one which you get from Canada or USA may not have the strips available here. So it is best to buy a glucometer. They have become very reasonably priced. They have become where the price has come down very drastically, and they are more affordable to most people. And I think we should use a glucometer which is available in our country, in our part of the I mean, even within the country, in your place, which is available, and which is whose strips are available easily.
Whatever is available locally and where you have good after sales service, and if you have something like which helps in personalized management, that would be good. So Dr. Rakesh, you handle hundreds of patients every day, busy OPD, you have so many students, juniors. Through traditional uh, methods of communication. We cannot be in contact with more than a few number of people throughout the day. How does this technology, how does IPDM allow us to be in continuous contact with a large number of people?
Yeah, so IPDM is basically meant to overcome this problem that is there when where you cannot see so many patients at one time and you're not able to understand what is happening to all of them. So I think IPDM connects them, and you can allot some time of the day where you're looking at that, you're providing them care, and then there are alerts whenever they have, when they're going low or low, whenever they're going very high, there are alerting systems which will alert the appropriate people. But at other times, it will help us in understanding how to make adjustments in the medication. So the person is continuously connected with his healthcare providers,
So it
and it is
helps in
always a team which takes care, and it cannot never be a single person who can manage
single
diabetes.
person.
Uh,
बट ये जो न्यू टेक्नोलॉजी है आईपीडीएम, कम्युनिकेशन की और ग्लूकोज चेकिंग दोनों की टेक्नोलॉजी है. सो इट चेक्स द ग्लूकोज, इट इज ग्लूकोविजिलेंट, बट इट आल्सो हेल्प्स अस कम्युनिकेट विद ईच अदर रियल टाइम. The entire glucose management team, that is the diabetes care team, is able to communicate with the patient, and you can also communicate with the relatives of the patient. So supposing a elderly lady living alone in India, बच्चे दुबई में हैं या कनाडा में हैं, they can also be part of that loop. They can also communicate and they can know what is happening to their parent. तो ये चीजें हैं कुछ एक जो newer advances हैं which we can sort of use for the benefit of our patients during Ramzan and even after that. Dr. Shubhlata Chetwal from New Delhi. Madam is a family health physician. Madam, greeting you, and also Seema ji saying thank you for all the information that you have shared with us. Seema ji has a point to say. Eating local helps a lot. That is right. Eating locally. So you eat things that are grown and produced in your part of the country, and also so does buying local. So if you buy meters which are available locally, which are of good quality, international quality, and which are also supported by IPDM and by after sales service. That will also help. Pratipati ji has a question. Even after maintaining HbA1c around 7, some diabetics still land up in kidney disease and dialysis. So, what is the reason? And actually, that is the importance of continuous 24-hour glucose monitoring IPDM. So, why is it that my HbA1c is 7, still I might get a complication?
So actually, HbA1c is a average which you are seeing. So somebody who has got 0 and 70 also will have an average of 35, whereas somebody who's maintaining the 30. I mean, I'm just giving a just example, but if you take it in the glucose range, somebody who's maintaining very high levels and very low levels will still have the same average as a person who is maintaining the levels in the normal range. So this technology of checking more frequently and probably getting also doing the continuous glucose monitoring will help us in knowing what the fluctuations that are happening. And the other point is that whenever the glucose levels go up or go down, there is more damage happening to the endothelium, as we are speaking of. It happens more when the glucose levels are fluctuating rather than when they're constantly in a particular range. So a person who is maintaining this is protected from complications. There's another person who has got a level of 7, but he's actually having wide fluctuation. So he's at more risk of complications.
And Dr. Rakesh, apart from glucose, what are the other things that we should focus on? Any targets, any lifestyle modification? If we
Yeah.
don't do
So
these, then we get into trouble. What are these
yeah.
things?
So because and as we are saying, we are not only looking at glucose, but we are looking at other parameters like blood pressure. The blood pressure also has to be adequately controlled. Lipid levels have to be controlled, and the person should not be. I should be advised not to smoke. If the person is smoking, then he's putting himself to risk of all the complications. So all these factors are also adding to the risk for developing the complications, and they all have to be kept in the normal range.
So, Mr. Rambabu, first of all, just if we talk about diabetes or glucose alone, HbA1c gives you a rough idea, the average, but we also have to minimize hypoglycemia, episodes of hyperglycemia, glycemic variability. and we have to keep on checking glucose regularly to ensure that we remain in range most of the time. And secondly, apart from glucose, we should also focus on other things like weight, cholesterol, blood pressure. And tobacco cessation is something that is important. We forget about substance abuse, but tobacco, Dr. Akesh, your comments, tobacco, alcohol,
Yeah.
kidney disease, liver disease.
Yes, yes. I think it's very important to understand that tobacco has a very strong effect on on increasing the risk for all these complications of diabetes. Actually, it has been also shown that it can cause diabetes also, and then when a person has diabetes, the heart disease, the kidney disease, the eye disease, everything increases when the person consumes tobacco. So it is not only the in the form of cigarettes, but also in the form of chewing tobacco or snuff and so many other ways of taking tobacco. All of them have the same harmful effect.
So don't get carried away by the advertisements that you see on TV. The people who advertise, I think they themselves don't take the tobacco, so they are intelligent enough to take care of themselves.
Correct.
But with Dr. Rakesh, we've had a great session today. Thank you so much for being with us. Our topic was glucovigilance during Ramadan. हमारा टॉपिक था ग्लूकोज के बारे में सतर्क रहना, चौकन्ना रहना रमजान के महीने के बीच में. तो यही डॉक्टर साहब ने हमसे बात की. यू हैव स्पोकन टू अस अबाउट द वेरियस ड्रग्स दैट आर यूज्ड इन रमजान इन डायबिटीज मैनेजमेंट, हाउ वी कैन मॉडिफाई द डोजेस. डॉक्टर साहब ने बात की कि कौन सी दवाइयाँ किस किस तरह से बदलनी होती हैं रमजान में. अपने डॉक्टर से जरूर बात करें. आज कल परसों अभी भी हमारे पास 5 दिन है, तो स्पीक विद योर डॉक्टर अबाउट हाउ टू मॉडिफाई द डोजेस. दूसरा डॉक्टर साहब ने बात की अबाउट ग्लूकोज मॉनिटरिंग ड्यूरिंग रमजान एंड हाउ वी कैन यूज IPDM प्लेटफॉर्म्स, integrated personal diabetes management platforms to help improve glucose vigilance and glucose control. डॉक्टर साहब ने बात की कि हम किस तरह से ग्लूकोमीटर का इस्तेमाल कर सकते हैं, अपनी शुगर चेक कर सकते हैं बार बार, ताकि हम हमारी तबीयत ठीक रहे और हम टाइम इन रेंज मैक्सिमम बिता पाएं. डॉक्टर साहब ने ये भी बात की, ही ऑल्सो स्पोक अबाउट द वेरियस सिम्टम्स, जो तकलीफें होती हैं जहाँ पे आपको शायद रोजा तोड़ना पड़े या एटलीस्ट अपनी शुगर जरूर चेक करवा लें उस टाइम. और ये भी तो देख सकते हैं ना, मान लो 12 बजे आपकी तबीयत खराब हो गई दोपहर को, and it is difficult that you will be able to manage 7 or 8 hours more, then you can break the fast. मगर अगर 7:30 बज चुके हैं और 15 मिनट रह गए हैं इफ्तार को, then you can manage for 15 minutes. तो ये भी एक विवेक इस्तेमाल कर सकते हैं अपना, मगर अकेले विवेक को इस्तेमाल करना ना करें. डू नॉट यूज गुड कॉमन सेंस अलोन. विवेक के साथ एक ग्लूकोमीटर को भी इस्तेमाल करें. यूज द ग्लूकोमीटर एज वेल टू हेल्प यू decide what to do, what not to do. With this,
Even a
Dr.
15 minutes, even a 15 minutes with very low sugar, like less than 60, is dangerous. Whereas if it is say 80 or 90, we can manage the 15 20
Manage.
minutes.
And if you have someone around you, someone to take care of you, then you will be more confident. If you are alone, then you should not take a risk. If your thinking is getting fuzzy, आप सोच नहीं पा रहे हैं properly, so that low sugar will harm your brain also, not only in the short run but in the long run. So all these multiple things are there, but as we become more and more vigilant, we will be able to have the answers to these questions. And the best way to answer these questions is by doing a glucose, by checking your glucose. आप सबको शुक्रिया करेंगे. I'd like to thank all of you for having been with us today. जैसा कि आप सब जानते हैं, हम रोज आपकी सेवा में हाजिर होते हैं. We are with you every day 7 to 8 p.m. मैं आपके साथ होता हूँ सोमवार और वीरवार. आई एम विद यू एवरी मंडे एंड थर्सडे. एंड इस वीरवार को हमारा बहुत ही इंटरेस्टिंग टॉपिक है. हमारे साथ होंगी डॉक्टर अक्सा शेख, हमदर्द मेडिकल कॉलेज न्यू दिल्ली से, एंड वी विल बी टॉकिंग अबाउट अंडरस्टैंडिंग ट्रांसजेंडर हेल्थ. सो डॉक्टर अक्सा शेख एक लीडिंग अथॉरिटी है इसमें, एंड शी विल बी हेल्पिंग अस अंडरस्टैंड दिस. Dr. Rakesh, one last question from Seema ji, and that is a point. You have talked about the Ramadan nutrition plan. So Seema ji is a health advocate, और इनकी एक बहुत बढ़िया वेबसाइट भी है जहाँ पे ये हेल्दी रेसिपीज डालती हैं. तो उनका क्वेश्चन है, if for sehri, for the early morning meal, we eat a high fiber diet like millets for example, then will that help in satiety and help in reducing hunger?
Yes, that is a very good plan that has to be highlighted. That in the Sahari, it has to be more of high fiber food, and complex carbohydrates, because they will not cause hunger, they will not cause increased insulin secretion, which will happen with other types of foods, which will cause hunger later during the day. So this will cause satiety for a longer period of time.
So
And
thank you सीमा जी for sharing this with us, and आपकी recipes वाकई बहुत अच्छी हैं. And for everyone, all these healthy recipes are there. They will help you not only for the sehri but for the iftar as well. So more of complex carbohydrates, more of millets, more of fiber, less of sugar, spices and salt. अगर आप सहरी में spices and salt ज़्यादा लेंगे, if you take lot of spicy food, lot of salty food, आपको प्यास बहुत जल्दी लगेगी. You will begin to feel thirsty. And अगर आप sugar ज़्यादा लेंगे, so you may feel good for a short period of time, but after 1 or 2 hours, that high sugar will come down, it will collapse, even if you are non-diabetic, and then you will feel unwell. So the glycemic variability, जो point Mr. Ram Babu भी share कर रहे थे about the average sugar is normal, but the ups and downs they will actually cause complications. So less sugar, less spice, less salt, less saturated fat, less ghee during the sehri, but more of high fiber diet and more of complex carbs, more of millets. So thank you, Dr. Seema ji. And Dr. Rakesh, we'd like to thank you once again. सबकी तरफ से आपको बहुत-बहुत शुक्रिया, बहुत-बहुत धन्यवाद for sparing your time and expertise with us. And
thank
we
you, it
look
was a
forward,
pleasure. Yeah.
yeah, we look forward to meeting you again on Thursday with Dr. Aksa Sheikh. एंड सीमा जी का वेबसाइट शेयर कर रहे हैं. इट इज हेल्दीफाई माई क्यूजीन बाय सीमा, यूट्यूब पे अवेलेबल है. एंड द नेम ऑफ द वीडियो इज मिलेट्स मेड टेस्टियर. तो इससे तो अब मेरे मुंह में भी पानी आना शुरू हो गया. डॉक्टर राकेश, आई थिंक द नेक्स्ट स्टेप इज टू थैंक एवरीवन, लॉग आउट एंड immediately log on to YouTube and let's look at Healthify My Cuisine by Seema, and let's see how to eat these tasty millets. So with this, once again, thank you and Jai Hind.
Thank you, Jane.